I am Dr. Elfred Batalla. I am an interventional cardiologist. I am an active consultant of Davao Doctors Hospital and I hold clinic at Davao Doctors Hospital. Today, I would like to discuss to you coronary artery disease, or in layman's term, pagbabara sa ugat sa puso. Before I would discuss further, I would like you to know the coronary artery circulation. If the patient will undergo coronary angiogram, there are 4 possible scenarios or outcome. Ang unang outcome po is pagsilip sa ugat sa puso, ang lumabas is normal. Kung normal po ang ugat sa puso, the best treatment option will be medical treatment or oral medicine lang po ang ibibigay sa inyo ng inyong doktor. Ang second possible scenario will be may bara pero mild lang po, or we call that mild stenosis. If the stenosis is mild, then the best treatment option will be medical management. The third possible scenario will be may nagbabara ugat sa puso na severe. Hindi na po pwedeng gamot lang, pero kailangan hong ayusin ang ugat dahil kung hindi ho ayusin, baka magkaroon ho ng heart attack ang isang pasyente. And pwede pong ayusin itong ugat through a process called coronary angioplasty. And fourth scenario will be severe na po ang bara, or what we call severe stenosis, and the best treatment option will be coronary artery bypass graft surgery, or kailangan na pong buksan ang mga ugat and dudugtungan po yung ugat, and that is a surgical operation. The most common cause of cardiovascular disease is coronary artery disease, or in other words, ang pinaka-common na cause ng pagsakit sa puso ay ang pagbabara ng ugat sa puso. Did you know that about 40% of all deaths caused by heart disease is due to pagbabara ng ugat sa puso? That's why we have to take care of the arteries of the heart. So, ano ba ang cause ng pagbabara ng ugat sa puso? Generally, we divide them into 2. The first is the modifiable cause and the non-modifiable cause. Sa non-modifiable cause, ito po yung hindi na po natin mababago. Ito po yung binigay ng Diyos sa atin na hindi na natin pwedeng mababago. One is age. Habang nag-edad ho tayo, there is a tendency na magbabara na ho ang ugat natin sa puso. Second is gender or sex. Usually, males have higher tendency of heart disease or pagbabara ng ugat sa puso than females during the female's pre-menopausal age. However, after the menopausal age, pareho na po ang tendency ng male and female sa pagbabara sa ugat sa puso. The third is genetic. Ito po yung lahi na namamana due to our genes, na meron ho tayong high tendency na magbabara ang ugat sa puso. So, for the modifiable cause, ito po yung pwede nating baguhin. Ito po yung we can avoid. Okay, number 1 is cholesterol. Ang high cholesterol diet will push us to have coronary artery disease. Second is diabetes. Kung hindi ho nakokontrol ang diabetes po natin, there is a chance na mas madali ho magbara ang ugat natin sa puso. The third is hypertension. Kung hindi ho natin makontrol ang blood pressure natin, there is high tendency of prematurely causing obstruction of the coronary artery. So the fourth is smoking. So for those people who are still actively smoking, I advise that you keep smoking so that you will prevent the clogging of the arteries of your heart. Next is obesity or overweight. And the next is inactivity or walang exercise. So those are the modifiable factors that will cause the blocking or clogging of the artery sa ating mga puso. Ito po yung sinasabi naming nagbabarang ugat sa puso ng tao. Ito po ang puso ng tao. Itong ugat na ito is what we call left anterior descending artery. Ito po yung bandang puno. Pagdating ho dito, lumiit ho yung ugat. Ito ho yung karugtong niya na malaki. Ito ho ang nagkukos ng heart attack ng tao. How do we diagnose coronary artery disease? Or paano po natin nalalaman na nagbabara ho ang ugat natin sa puso? Well, the number one po na dapat yung gagawin is pumunta po kayo sa inyong cardiologist. Because your cardiologist will give you laboratory test para ma-diagnose kung meron po kayong nagbabarang ugat sa puso. Magre-request po ang inyong cardiologist ng ECG, 2D echo, and probably stress test. And if these are abnormal, then you will be referred to this facility. This is what we call cardiac catheterization laboratory. Dito ho ginagawa ang angiogram or pagsilip sa ugat sa puso. So, how long usually will the patient stay in the hospital? Ngayon po na time ng COVID, once you come into our hospital, you will be tested with PCR or swab test. After the test will be negative, then we proceed with the coronary angiogram. Kung ma-angiogram po kayo ngayong araw na to, kinabukasan po, dinidischarge na po kayo namin. Angiogram procedure will only take about less than an hour to do the procedure. However, if an angioplasty will be done or pag meron pong aayusin na ugat, then most probably it will take about 1 to 2 hours to do the angioplasty. And you will stay, and the patient will stay overnight in the ICU. And if the patient is stable, the next morning, he will be wheeled back to the room. And the next day, patient is already discharged. My advice to everyone is let's take care of our heart. Meron lang ho tayong isang puso. And that's the only chance we got. So let's take care of our heart by avoiding high cholesterol diet. If you are diabetic, you have to control your diabetes. If you are hypertensive, then you have to control your hypertension. If you are a smoker, then I advise that you quit smoking now. If you are obese or overweight, you have to lower down your weight to your ideal body weight based on your height. And let's start doing exercise and live a healthy life so that we can prevent coronary artery disease and we can take care of our heart. Thank you.